Okay, so palpating the surface anatomy of the lower limb. Starting off at the greater trochanter of the femur. This is easier to locate in men because of, I mean in women because of their wider pelvis compared to men, which is most likely covered by bulky muscles. Okay, so to locate this, the greater trochanter of the femur, it is lies it typically lies from 6 to 8 inches from the iliac crest. So the iliac crest is the highest point of the pelvis, which is right here. 6 to 8 inches. So here, the 6 inches is like here, and you will feel like what is this? Like a circle, like a circle from here. That is the greater trochanter of the femur. Okay, so for the patella and tibial tuberosity, we're gonna feel the kneecap and palpate the ligaments attached to its borders. Okay, so the inferior ligament, which is here. So first of all, this is the kneecap, and just below the kneecap we have the ligament attached to the kneecap, attaches bone to bone. So here is the quadriceps, just above here. If you lift up and then extend your legs, you can feel the tendon. So this is the tendon just below the kneecap, and then you will feel here, under here, a slight bump, which is the tibial tuberosity, where it attaches. Okay, so moving on to the lateral malleolus. It is the most lateral aspect of your ankle. Your ankle is over here, right there, where my fingers, my thumb are touching, and my middle finger. Okay, so this is you will feel the bulge here, the medial malleolus of the fibula. There is a bone here. This is called the tibia. There's a bone here, small bone, which is the fibula. The medial malleolus of the fibula. This is the lateral malleolus, the bulge here. Okay, moving on to the medial malleolus. The medial malleolus is the protrusion of the ankle here. Here, it's the protrusion of the ankle. It is the medial malleolus of the distal tibia. Remember this, the distal tibia. This is the medial malleolus. Now moving on to the calcaneus or the heel bone. So this is the calcaneus, where it goes down like that. That is the calcaneus. Okay, so demonstrating the movements of the synovial joints. First, we have flexion, a movement generally in the sagittal plane that decreases the angle of the joint and reduces the distance between the two bones. Flexion is typical of hinge joints, bending the knee or elbow. Another flexion, but it is also common at the ball and socket joints, bending forward at the hip, like this. Flexion of the knee. Now we have extension, a movement that increases the angle of the joint and the distance between the two bones, straightening the knee or the elbow. Extension is the opposite of flexion. If extension is greater than 180 degrees, for example, bending at the trunk. Like that. It is termed as hyperextension. The next one that we have is abduction, movement of the limb away from the midline or the median plane of the body, generally on the frontal plane of excuse me, frontal plane, or the fanning movement of the fingers or toes when they are spread apart. This is abduction. It is the movement of the limb away from the median plane. So now the next one is adduction, movement of a limb toward the midline of the body. Adduction is the opposite of abduction. So this is the abduction of the legs. This is the adduction. Abduction, adduction. So now we have rotation. Rotation, movement of a bone around its longitudinal axis. Rotation, a common movement of ball and socket joints. Also, and describes the movement of the atlas around the odontoid process of the axis. Okay, so now we have circumduction, a combination of flexion, extension, adduction, and abduction and adduction, commonly observed in ball and socket joints like the shoulder. Here, this is the ball and socket joints. The proximal end of the limb remains stationary and the distal ends move in a circle. The limb as a whole outlines a cone. This is an example of circumduction. It is the combination of all of it. As you can see, it makes a cone. Okay, number 7. We have pronation. Pronation, movement of the palm from an anterior or upward facing to a position to a posterior or downward facing position. Like it's pronated. This action moves the distal end of the radius across the ulna so that the bones form an X. Okay, so now we have supination. Supination, a movement of the palm from a posterior position to an anterior position. Then the anatomical position. Supination is the opposite of pronation. During supination, the radius and ulna are parallel. This is supination. Now we have inversion, a movement that results in the medial turning the sole of the foot. Okay, so the next one is inversion, a movement that results in the medial turning of the sole of the foot. Inversion. The next one is eversion, a movement that results in the lateral turning of the sole of the foot, the opposite of inversion. Like this. The next one is dorsiflexion, a movement of the ankle joint in the dorsal direction, standing on one's heels. Dorsiflexion. The last one is the plantar flexion, a movement of the ankle joint in which the foot is flexed downward, standing on one's toes or pointing the toes. Like this.